I have dreamed about being a doctor, delivering babies, and connecting with women since I was 5 years old. This passion, hope, and love for women's health was my North Star. I excelled in my math and curriculum and breezed through the weed out classes in college. In medical school and residency, I was warned that work life balance would be challenging. That did not faze me. My focus was on working hard, learning all of the medical systems, and the ins and outs of obstetrics and gynecology. As a young, newly minted attending physician, I was focused. My main priority was on building my confidence, developing clinical relationships, and improving my clinical and surgical skills. I worked really hard to be a good doctor. There were clues that something was off. I recall visits to the practice administrator and sharing my concerns about some of the culture or practices I observed. I was quickly dismissed, and I figured out early on it was my job to go with the flow. At that time, I didn't have the agency or leadership skills to change routine practices or to center the patient experience. And I now understand that these are crucial to improving clinical outcomes. So I carried on and made an impact with the patients I directly cared for. I worked the 24-plus hour shifts. I saw the outpatient schedule loaded with 30 or more patients in a day, like so many other doctors. And like so many physicians, my identity was wrapped up in my career. I had my daughter, Athena, in 2018. 18 months later, I'm pregnant with my son, Lucas. In the middle of a global pandemic, with the unjust murder of George Floyd, it felt like everyone went from never talking about race and racism to everyone talking about it all the time. And on top of that, 350,000 American lives lost from COVID-19 during the year 2020 alone. It was July 2020, and I was very pregnant with my son. I remember so vividly being on call, wearing the N95 mask for hours on end, feeling shortness of breath after talking to patients all day. I remember trying to stay in my call room for as long as possible because I was scared. Even I had questions about the impact of the COVID-19 virus, safety of any vaccine, how would it impact my pregnancy and my young growing family? This might be a shock, but doctors don't always know everything. I remember struggling to be an OBGYN, a Black woman, mom, physician, and getting up to go to work and do the same job like everything was okay, because it was not. After my son Lucas was born, there were more open articles and discussions about Black maternal birth and healthcare disparities. So when I returned from maternity leave, everything felt different for me. Everyone was fatigued and anxious. I was fatigued and anxious. But I no longer had the capacity to rush through patient visits when it was fulfilling to slow down, connect, and allow people to talk. How did the healthcare system get here, where I felt the need to rush through patient visits and not take the time to truly understand people's needs or help them identify the root causes of their health concerns? I had already started trying to piece together what is the United States healthcare system. I have since learned about race science, polygenics, eugenics, its origins, and medical apartheid. I learned about the history of modern OBGYN. I learned about Lucy, Betsy, and Anarcha, the Black enslaved women whose bodies were used to advance GYN surgery. About how obstetric physicians replaced the granny midwives and their indigenous and ancestral practices some of which crossed the Atlantic, and other false race-based practices, like Black patients have thicker skin, higher pain tolerance, and better kidney function at baseline. Learning this history helped me fully understand how racism is at the core of modern medicine and our healthcare system, which impacts patients, resulting in lack of trust and disparate outcomes, which impacts doctors and physicians in training, and does not support the health and well-being of the people that work in it. Then I learned about the mind-body connection in burnout, and I saw myself in the description. I recall an unshakable feeling of brain fog, a constant list of to-do items swirling in my head. Rest was not restful, and work and home life never felt complete. Burnout is described as emotional exhaustion, depersonalization, and a low sense of personal accomplishment at work. It can also be described as mental health-related anxiety and depression. Even before the pandemic in 2019, it had reached crisis levels, impacting 54% of doctors and nurses, 60% of medical students and residents. 50% of all healthcare workers nationwide have had their mental health impacted in some fashion. This is causing doctors, nurses, and healthcare workers to leave medicine altogether. We all know our healthcare system is in crisis, creating, among other things, a maternal health crisis. The maternal mortality rate is worsening, and Black women in Massachusetts are almost 2 times more likely to die during pregnancy or postpartum compared to white women. Black women fear going into the hospital for what should be the most joyous occasion of their lives. I'm a Black woman. My sisters are Black women. My mom and daughter are Black women. When I flew thousands of miles to be there for my sisters when they were giving birth last year, I became more deeply aware of my own lack of trust. As their support person and experienced physician, I wanted to confirm that they received the most optimal clinical care. I accept the responsibility to help guide women through what should be the most amazing, glorious, transformational experience, the birth of a child. But instead, we have fear, and the data shows it's warranted. Physician burnout and the burnout of all healthcare workers contributes to our healthcare system being in crisis. We have to change this now. Doctors and healthcare workers cannot lead people to health and wellness if we are not well ourselves. We are not machines, and we have unrealistic expectations about how much we can do or perform. Psychologists and psychiatrists discuss how trauma, direct, generational, and racialized trauma impacts us all. With mind-body tools and techniques, we have the capacity to strengthen our ability to pause and reconnect to our bodies. These tools are foundational to wellness practitioners. Integrating them into our healthcare system can turn healthcare into healing care. I learned about these tools because I recognized pretty quickly that I needed them. I remember one of my first restorative yoga sessions. And I still don't know if it was the yoga position, the sound bowls, or the loving, caring words the instructor shared. But I cried the most healing, soothing cry. The continuous stream of patients, the unrelinquishing inbox and patient messages, and the tears and cries of my children started to melt away. When I experienced burnout, I took a pause. I looked at our healthcare system and its history to better understand the current situation and crisis. It is with this renewed energy and sense of purpose I started to imagine what is possible. A holistic approach to health and wellness addresses the physical, mental, emotional, and spiritual well-being of patients and healthcare workers. To my fellow physicians and healthcare workers, everyone is not broken. It is the system. We must start with a holistic assessment and reflection of our needs and well-being. If the problem is burnout and doctors and healthcare workers working within a culture that does not allow for humanism, the solution is a culture of care. We can create systems where community lies at its core, where collaboration and shared decision-making is a priority, where listening, inclusivity, and genuine concern for each other is the norm, where we work in environments that are calm, comfortable, and visually pleasing, where we have grounding practices throughout the day, and meditation rooms, where we support each other in strengthening our pause muscles, where we support each other in checking in with ourselves, where we are present with each other. Maternal health, healthcare disparities, burnout, and more make up a healthcare system in crisis. I see a future where we integrate these wellness tools into our everyday practice. This isn't something that we should do. This is something that we must do, and the time is now. I still have so much hope, love, and passion because I've reset my North Star. It now includes a holistic approach where wellness, healing, and transformation is offered to and by healthcare workers, caring for patients with the compassion and love we all deserve.